Hi, this is Dr. Greg Dorr, and what we're going to do is the TheraBand kinesiology tape application associated with the deltoid and the supraspinatus. Now, this is an application that we're going to use frequently for people that might have some anterior shoulder pain or possibly referral patterns into the lateral arm. It's a neurologic application, so we're going to use our small exact stretch indicator to determine that we're under 25%. So our first measurement is going to be from our acromion process to the deltoid. And this one's going to be a Y strip. So we're going to actually cut two tails, leaving a 2-inch base at the bottom. We're going to round our edges. And as with our neurologic applications, what we want to do is stretch more of the tissue and less stretch in the tape. So we're going to break the backing on both tails, peel off the base, apply the base just below the deltoid tubercle. And now what we're going to do is stretch that tissue. So the way that we have this developed, it's going to go around the anterior and posterior borders of the delt. So when we're doing the posterior border, we're going to bring that arm across to apply stretch to the posterior deltoid. And again, making sure that we don't exceed 25%, we're going to follow the posterior border of that deltoid up towards the acromion process. And now we're going to bring the arm back and open it up into what would be a supinated position of the arm, or the forearm. And we're going to apply the tape along the anterior border of the deltoid. Once again, we want to make sure that our small hexagons haven't equaled out in their shape, otherwise we're exceeding our 25% stretch. When you use these neurologic tapings, what you'll notice is when you put the tissue on a stretch, you can see these convolutions that will develop in the tape. This is a normal reaction that will happen associated with neurologic applications. And if we bring her to the front and turn it in, we can see the same thing develop in the front of the shoulder. So the second part of this application is going to be for the supraspinatus. Now, this is not really necessarily a neurologic taping associated with the course of the supraspinatus. What this is a little bit more of a mechanical application. The goal of it is to almost push the head of the humerus back into the glenoid. So we're going to measure from the front to the back of the humerus. Round our edges. Fold the tape in the middle and just break in the middle again. We'll hold the thumb and the first finger to hold the tape with the backing, and then our first finger and our second finger to hold just the backing. We're going to stretch that tape at about 50%, which again will make sure our large hexagon equals out in sides. We're going to put our patient into a good anatomical position and apply that stretch right onto the lateral aspect of the humerus. And we can use the backing to activate the adhesive. And then again, this is our application for a deltoid and a mechanical correction associated with our supraspinatus that we'll use for anterior shoulder pain or possibly ones with lateral arm referral. For more information and applications using TheraBand kinesiology tape, go to therabandktape.com.